Originally from Huntsville, Alabama, the son of a rocket scientist and a nurse. Started my post-high school journey at Auburn University. I thought I wanted to be an aerospace engineer, but gravitated more towards the biological sciences and realized that I wanted to go to medical school and become a doctor. From there, I was at UAB for medical school, where I learned quite a bit just in terms of patient care and patient interaction. And from there, I realized that I liked not only the thinking and the thought process aspect, but also the actual doing, the hands-on portion of medicine. And that really led me to orthopedics. From there, I was fortunate to be able to be a part of the Campbell Clinic, which is a residency program in Memphis, Tennessee. And I was there for 5 years and then did a post-residency year, so a year of fellowship at Andrews Sports Medicine Institute in Birmingham, Alabama. The process of getting back from an injury, whether it's on a field or from a weekend warrior or just someone who was unfortunate enough to have an injury, is really a team approach. And I love the part that I get to play in it, particularly being able to lead and orchestrate the patient's care in concert with physical therapists and athletic trainers. Really, I tell all of my patients that my part is actually a fairly small part. It typically takes about an hour to an hour and a half, alluding to the idea of surgery, and that their part is the much bigger part, the recovery, that process. And it takes a team approach, and I enjoy that team aspect. A typical day start out in clinic, where I'm seeing patients of all ages, anywhere from 5 all the way up to 95 and even older. Some patients are patients who have had injuries from like high school athletics, but plenty of others are patients who have had ailments or are having issues unrelated to a sporting activity. Typically from there, I'll have a case or two at our hospital here over at Piedmont Fayette, and then especially during the fall season, during the football season particularly, I cover one of 5 local high schools: Fayette County High School, McIntosh High School, Whitewater, Stars Mill, and Sandy Creek. In addition to the high school athletes, we have a lot of other patients who aren't necessarily affiliated with a school or a sports program, but are still oftentimes playing sports like pickleball, as that popularity of that sport has increased, as well as sports like tennis and golf, other sports that are popular not just in the high school and young adult age groups, but really all the way out through the rest of our years. And so we work closely with those patients as well to help get them back to their goals of getting back onto the golf course or getting back onto the pickleball. I've had multiple families where I've cared for all 3 generations, where maybe my first contact with them was through their child who was playing sports and was injured on the field. And then through that, I've gotten to know the rest of the family. And when the child's parents have issues with their shoulder or with their knee, they're coming to me. And even most recently, I've had a couple of patients who brought their parents. So the patient was originally the high school athlete. Their parents came because we took the time to develop the relationship locally, and then even so, they brought their parents, the 3rd generation, in to be cared for. Quite a few of my patients, especially from the athlete side, are having injuries related to shoulder instability and ACL, and both of those procedures I do all through an arthroscopic or minimally invasive technique. I would say the majority of the surgeries that I'm doing on the in-sport athlete tends to be an arthroscopic or minimally invasive procedure. So I think a big thing that makes Piedmont Orthopedics Ortho Atlanta unique and special is their commitment to the community. Just being a surgeon and treating a patient isn't really enough. Like, you really need to be part of that community. You need to be accountable for the people who are around you and to be present for them as well. And I think Piedmont Orthopedics Ortho Atlanta has done a great job by that, including the outreach that they've done through partnering with these high schools and helping to get these high schools set up with athletic trainers. So that way, even in non-clinical settings, we're able to help make sure people's healthcare is as optimized as possible. One of my favorite quotes from Vince Lombardi is, "It's not whether you get knocked down, it's whether you get back up." Probably one of the most gratifying and humbling parts of being really a provider of any kind, but especially an orthopedic surgeon, is when you care for a patient and through that they trust you and feel comfortable enough with you and know that you care for them in such a way that they are not only willing to bring themselves to be treated, but they bring the ones that they care and love for. For me to be able to be a partner in their care is extremely gratifying and it's humble. The big thing that I want them to know is I'm local. I'm involved with their kids' high school sports. I'm not someone who's coming in from Atlanta. I want to be part of this community and I want to be part of the community that I treat.